going to review the Lodi tape. Again, this is a more comprehensive support tape, what you would think of as a full foot orthotic for arch support. We are going to use, typically I would use 1-inch athletic tape. We have 1.5 inch in clinic. So I'm going to do the anchoring strips of 1.5 inch, and then I'm going to tear it so it's only a 1-inch tape whenever I do my supporting strips. So whenever you're doing your anchoring strips, again, we don't want to be up here compressing too far up on the met heads. Okay, just a little bit below. I usually don't worry about closing it off from the top when you're not trying to give any compression through this tape. It's essentially just providing an anchor for the other tape to go down. Sometimes I'll put one strip, I'll come over now and put two. Okay, again, not trying to pull through here, this just lays down flat. And then if you're in a clinic that only has the 1.5 inch, you can just modify on your own. And then now what I'm going to do is I'm going to take different loops wrapping back around the back of the foot and go from the 5th head to 5th, 4th to 4th, 3rd to 3rd, 2nd to 2nd, 1st to 1st on each supporting strip. If you're talking about an athletic population, you're going to want to provide some sort of cushion or some sort of buffer here on the heel between the tape, whether this is a foam pad. Sometimes I even see people use foam pad and some sort of loop just to keep this from blistering. If you're using this more as a diagnostic in clinic or something that's just going to be worn for a day or two, you should be fine without it. So starting off, I'm going to start the 5th met head. Okay, wrap around. I'm trying to minimize any wrinkles in the tape. I'm not saying it's going to be perfect, but minimizing the amount of wrinkles that we have, just because excessive wrinkles will create some blistering or some rubbing on the skin. Okay, and then from here, walk the tape out and twist it, okay, to get the angle that you want with the least amount of wrinkles. So sometimes you're going to have to come up and lay it and adjust accordingly. It's a little higher. You see a little bit of a wrinkle there. So measure it, and then from there, it's the same way as on the navicular unload tape. I'm going to come here, fix it, and then pull up the arch. Okay, and then lay that down. Sometimes it takes some playing around with to get the angle right on this tape. It's going to be easier with the 1-inch tape as opposed to the 1.5. Same thing here, not pulling hard around the heel, just laying over the heel and then measuring up, ripping, and then from there fixing and pulling up for the support. It's really important that you're not pulling hard around the heel, because then when they stand up, they'll feel that pull. Third to third, clamp down there, and then give the force up the foot. Finally, you're going to have going 1st to 1st. So you notice how I do pull the tape out, measure this way, and then tear. If you try keeping the tape, the roll really close to where you're taping, it's going to be awkward to project out where the tape's actually going. Here, clamp down and pull up, and then lay it down. So that's probably the most difficult portion, is getting the angles right and practicing with the angles. Next, what you're going to do is more of a closing type strip, and you're also going to support the transverse arch. Okay. So from here I'm going lateral to medial with this tape. Okay, I'm going to start at the heel. These aren't going to have a lot of force whenever I'm pulling. Okay. These are more just closing the tape, and I'm going to do a 50% overlay. I'm trying to avoid the wrinkles. I would probably go back and fix that wrinkle. So again, 50% overlap. As I start to get in the arch here, I'm going to give a little bit of a pull to support the or the transverse arch. Okay, especially through this portion, I'm fixing here, pulling up through the arch, and then tearing. Fix, pull, tear. So I would say this portion of the foot is going to be most important to get a little bit of a pull to support the arch. And then once you get over the met heads, you're not going to want to pull nearly as hard. It's just going to be, again, up here it's going to be just laying it down to close off. Same thing as it was down closer to the heel. And then just a closer strip up here. After I have both the longitudinal support and then as well as lateral to medial support, I'm going to come in and just close off the tape. Okay, to do that, I'm just coming on the lateral border. It's essentially where my tape was going. If you can't really see it really well, it's just, you can actually bring your foot over. And I'm essentially just covering where the tape was going up just to close it off. More than anything, this is just trying to make it look pretty. It's going to close it and keep also socks from grabbing the edge of the tape and pulling it down away. Okay, so from there, walk it up. Just trying to walk the tape out. Okay, so I'm not pulling a lot of this in, I'm pulling down. Okay. Got that. And then from here, just trying to close off these loose ends of the tape. Okay. And then to close it all together, get my tie in your foot. I'm going to come up over top, not giving any compression, just to close it off. And this is a part where it's really important not to just wrap like this, because especially if you're going to have somebody walking on this tape for a while and you compress through the met heads, you're running a risk of having a stress fracture through the met heads. There you go. So what you want to do next is just stand up and ensure that whenever they stand up and walk on it, they're not feeling a significant pull at the heel, that it feels more of like a full arch support.